Hello and welcome to World Health plus Social Good. I'm Vismita Gupta-Smith and we're coming to you live from the 71st World Health Assembly here in Geneva, Switzerland. Thank you for joining us. Here we are at the heart of the assembly, and the top leaders from 194 countries are gathered in the room behind me. Anytime that many top leaders, global health leaders are gathered in a room, you can be sure that top actors and experts in global health are also around, and that's who we have lined up for you this week on our shows. We want you to be part of the conversation. You can send us your questions on Facebook, or you can tweet it to us, tweet your questions to us at WHO using the hashtag WHA and hashtag SocialGood. Susanna Rosenblatt from UN Foundation is going to ask your questions. Hi, Susanna. Hello, welcome. It's already been a very busy week. Before the World Health Assembly started, WHO Director General Dr. Tedros Ghebreyesus led an event called Walk the Talk here in Geneva. You're seeing some images from that event now. There was more than 4,000 participants from Geneva and all around the world. This event was part of the recognition of the importance of health and well-being. As you can see, people took part in many events, yoga, dance, and all kinds of physical activities. And once the fun ended on Sunday, well, once the fun was over on Sunday, the assembly started. Those were some images of WHO celebrating, member states celebrating WHO's 70th anniversary. And one of the first things we heard was the speech by Dr. Tedros. And in his speech, this is his first year, this was his first year, so he gave a report back, an update to the member states, and also looked ahead at the direction that WHO will take.
Happy birthday to you.
WHO's Director General reported back to member states about the progress that's been made so far. And one of the most important goals of WHO is to ensure that people have access to quality health services, and not just access, that the services are affordable. And this, we refer to it as universal health coverage. You may have heard the acronym UHC mentioned several times. Let's take a listen to the Director General talking about UHC in his speech.
I know from my own experience in politics that with buy-in from highest levels, anything is possible. Without it, progress is difficult. That's why I have made a priority of engaging with leaders all over the world to advocate for political action on health, and especially on universal health coverage. What I have discovered is that most leaders I talk to need little convincing. We're living in a time of unprecedented political commitment for health. I saw this very clearly during my first week in the job, when I was invited to speak at the G20 meeting in Hamburg. It's clear that the twin messages of health security and universal health coverage resonate loudly with world leaders. At the Executive Board meeting in January, I issued a call to all countries to commit to 3 concrete steps toward this universal health coverage. Several have already started rising to the challenge.
There you heard the Director General asking countries to commit to universal health coverage. This is the concept of ensuring that affordable quality health services are available to people without them going into financial hardships. We want to unpack this concept of universal health coverage a little more, and to do that, here with me is Dr. Naoko Yamamoto, Assistant Director General for Universal Health Coverage and Health Systems here in WHO, and with you, Dr. James Fitzgerald, Director of Health Systems and Services for WHO's America regions. Welcome to both of you.
Good afternoon.
I'm going to start with you, Dr. Yamamoto, because I know you have very little time. We're going to be losing you soon. Explain to us in simple terms, what is universal health coverage? What is it and what it isn't?
Universal health coverage is a social system to support the people be healthy, to support the people enjoy their healthy life and develop their own potentials. The UHC, universal health coverage, also provide medical services and care if he or she be sick or injured without hardship of the financial hardship. So universal health coverage is the system that allow make the people not have to decide death or live. And this is a social system. And universal health coverage is not a disease-specific program, and also it's not like a care for the specific or limited people. It's for all. And also, the universal health coverage is not mean that everything is free. So, I think.
So, what are some of the challenges that countries are facing on the ground in implementing universal health coverage?
There are a couple of challenges. Well, first of all, I should say universal health coverage is achievable. It's we could come up the universal health coverage, the reality. But one of the biggest challenges is lack of resources, especially for the human resources. Also, the efficiency to use the resources. And I should add another challenge is how to invest the solidarity of the society to help each other. So I think there are a lot of good examples to overcome those challenges.
Dr. Yamamoto, you have been part of the conversation about universal health coverage when it was being discussed, even as part of the Sustainable Development Goals, as the global leaders were setting that goal in 2015. Are you noticing a change in the mood, in the commitment of people at the Assembly here?
Definitely. I very strongly feel there's a change. A couple of years ago, somebody doesn't know about UHC. What is UHC? Or somebody is suspicious that achieved it. But this time, during this WHA, many leaders, global leaders, not only the health ministers, also the head of states, Minister of Finance, a lot of people believe and also committed to achieve UHC. So I think that I feel very strong movement is coming. And so we have to keep this high-level political commitment, but at the same time, we need to change the life of the people at the ground. And not like a slogan or talking about UHC, but we have to implement it. WHO, hopefully, and believe to be a strong partner with the countries and the people and the community people to achieve universal health coverage.
So, Dr. Yamamoto, what do you think is causing this change? What specifically are countries doing and committing to?
Actually, first of all, as I said, that strong political commitment. But also, the people, we have a wonderful example or experience which has already improved the health system. And we share with them, and many people understand how to work it. So, I think the commitment for the political, but commitment from the ground is coming. So now we are the time to work at the ground.
Dr. Yamamoto, I know you have a commitment of time, and we'll be losing you now, but thank you very much for sharing your time with us.
And thank you very much for giving me this opportunity. Thank you.
Sure. Now, we've heard this again and again that universal health coverage is not one size fits all. There are many, it takes many shapes and sizes depending on health systems and many other factors. I want to talk to you, Dr. Fitzgerald. You're seeing many examples on the ground in the region that you work in. Share with us, what are the approaches countries are taking to UHC?
Well, that's a great question. You know, in the Americas, the whole question around universal health coverage came to us in 2014. And the countries posed a question, what does universal health coverage mean to health systems that are built on the principles of the right to highest attainable standard in health, equity and solidarity? And they really kind of went through a process whereby they looked at their health systems and they engaged in a dialogue across the 31 countries of the organization. And they said, okay, what we need to really do is to make sure that we have universal access to health, and within that concept, universal health coverage. That means expansion of health services that are comprehensive, from health promotion to diagnostics to treatment to palliation, developed based on primary health care. It means increasing health financing, particularly public health financing for primary health care, elimination of out-of-pocket payments, particularly at the point of care, and then really addressing the social determinants of health, so that the health we can really make effective health for all within the concept of universal health.
Explain social determinants of health to me.
These are those factors that really impact the health condition of the individual. It is like education, it is like income level, it is like living conditions, healthy spaces, all those external factors that impact the very essence of an individual and your health status.
Right.
Obviously, access to health services is in itself a social determinant of health.
Right. So what are some of the challenges that you're seeing on the ground?
I think ADG Yamamoto mentioned principally the two challenges. I think that there is this political movement, that is clear. I think countries have clarity around how the models of organization of the health system. I think that's also good, very much based on primary health care. Two main challenges we see constantly when we're working on health systems transformation in the Americas. The availability of qualified human resources for health. We see a mismatch between what the education sector is producing and what the health system needs. And the second is the progressive increase of public financing in health, where we can progressively allocate more public finances to really reach those that are in need, the vulnerable populations that we're all talking about here.
I want to stop there for a minute to take a question from Susanna from the audience. Susanna?
Okay, great, thank you. One question we're getting is, we want to hear from you all about some universal health coverage success stories around the world, and what can we learn from nations who've been able to prioritize affordable and quality healthcare for all?
Success stories, yeah, I think there are actually many of them. If we look at the more recent success stories, for example, in large countries like Brazil that implemented the Mais Médicos program, very much based on the family health program, we're really expanding out into the, I suppose, more rural and underserved regions, the family health program, and resulting in an increase of over 60 million people having access to comprehensive health services based on primary health care. Or we see the examples that was well presented by the minister in Ecuador, where you have the Medical Barrio, where again the health teams go out and they reach health and they integrate the health services with an integrated network. Or in the Caribbean even, in some of the health systems transformation processes that are being addressed through national health insurance reform, where we begin to look at the comprehensiveness of the service offer of the whole population. So irrespective of the income level of the countries, there's always something we can do to make sure that we address that issue of universality and solidarity and equity.
So, Dr. Fitzgerald, you touched upon it a little bit earlier in this segment, but tell us about, regardless of what shape UHC takes, some key elements that must be part of UHC. Could you elaborate on that again?
Right, yeah, I did touch a little bit on that. For us, we say that there are 4 critical elements that we really need to address as we move forward towards the achievement of universal health. One, a political commitment to expand comprehensive integrated health services based on primary health care. That is so important. 2, to increase financing, particularly public health financing, with the progressive elimination of out-of-pocket expenditures at the point of care, and optimizing pooling so that we can pool risk. 3, to strengthen governance and stewardship of the health sector, and not just within the health sector, but within government as a whole. And then 4, addressing the social determinants of health, which we talked about already.
Thank you very much, Dr. Fitzgerald, for joining us today.
Thank
so
you.
You heard just now about UHC, and this is mostly from the WHO perspective. I want to now explore a little bit, what does that look like on the ground? And to do that, we have with you Deborah Toms. Deborah, you are the Chief Nursing and Midwifery Officer for the Commonwealth of Australia. Welcome. Tell us, first of all, explain a little bit to me, what does the Chief Nursing and Midwifery Officer do?
Thank you. Yes, well, the Chief Nursing and Midwifery Officer in my role in the Commonwealth Government is about providing advice to government from that nursing and midwifery perspective, but also providing advice on how nurses and midwives can contribute to the achievement of various health policies.
So let's talk a little bit more about that. What do nurses and midwives bring to UHC on the ground?
I think one of the things that nurses and midwives bring is an absolute understanding of how communities operate. Many nurses and midwives are embedded and live within these communities, and they well understand the challenges that the various communities have and can build those relationships to bring about strategies and solutions for improvement.
Right, because they are in touch with communities so much, right?
I want
to take an audience question before we go on.
Sure, thank you. We also wanted to recognize that there are people tuned into the broadcast from all around the world right now. Greece, Colombia, Malaysia, Mexico, the United States, the Philippines, India, Somalia, South Africa, Italy, and more. So thank you to all those viewers. One question is regarding the financial hardship imposed by healthcare costs. More than 100 million people are pushed into poverty each year due to healthcare costs. So how can advancing universal health coverage help countries achieve other global goals, help improve people's lives in other ways?
Well, I suppose I can speak more from my own experience whereby, and I think as the previous speaker mentioned, political will and financial commitment are important to bringing about those changes. And in my own country, the government, we have a national insurance scheme. We have strategies to enable people to access health services at no cost, particularly those that, for example, may be unemployed or have special needs. There are specific schemes, and so I think that it's looking at a range of opportunities to develop different strategies to perhaps meet the needs of different components of the population.
Deborah, now access is a very important part of providing universal health coverage. Australia has had universal health coverage in place for several years now.
Yes, a long time.
How have you overcome the access challenge of the access in remote areas?
Well, yes, access can be a challenge in Australia from a geographical standpoint in particular, given that most of our population lives on the coastline, but we have smaller populations in very remote areas. So we use a range of techniques. Obviously, we have some small clinics where you will have doctors and nurses. We will have other clinics where there will be nurses, they are nurse-led. In even more remote communities, we may have nurses who travel out by vehicle, by road, and hold local clinics. We also make great use of the Royal Flying Doctor Service, so we fly people in to deliver clinics, but also for emergency transport and treatment. And increasingly, we're seeing the use of technology, whereby video technology enables perhaps a nurse with a patient to talk to a medical specialist who may be several thousand kilometres away, but you can feel like you're all sitting in the room together.
So let's talk a little more about the role of technology, innovation in delivering health.
Look, I think that we're perhaps only beginning to realise the potential that technology can bring, but more and more through the use of things, as I say, like video technology, but also the fact that you can take an ECG on someone and have that sent to someone to read it many thousands of miles, kilometres away. X-rays can be taken and interpreted in another country, and you have almost instant feedback. I think it enables us to really improve the services that we can provide to people who live in remote communities.
Thank you very much, Deborah, for joining us today.
Thank you.
So universal health coverage is part of our vision for the future. But since we're also commemorating the 70th anniversary of WHO, we'll spend the rest of the show looking back at some of the biggest public health achievements in the last 70 years. Let's take a look at public health then and now.
For 7 decades, the World Health Organization has been working to improve everyone's health, whoever they are and wherever they live. We have worked hand in hand with governments and a multitude of partners. Together, we have made huge progress. Babies born 70 years ago lived an average of just 47 years, whereas today, they will live an average of 72 years. That's 25 additional years of life. 7 decades ago, 1 child in every 5 died before their 5th birthday. Today, that figure has dropped to 1 in every 250. People would live in fear of infectious diseases with no known cure. Polio epidemics swept through communities, paralyzing millions of children. In the past, smallpox infected 50 million people every year. Now, smallpox has been eradicated from the face of the earth, and cases of polio have reduced by more than 99.9%. But there is so much more we can do, and we cannot afford to lose momentum. More than half of the world's population is still missing out on essential health services. Non-communicable diseases such as cancer, diabetes, and heart disease now account for 70% of all deaths. And by 2030, climate change could cause an additional 250,000 deaths annually. In our interconnected world, infectious disease outbreaks can spread more rapidly than ever before. But together, we have shown we can tackle the most complex global health challenges. Every month, the World Health Organization screens 5,000 disease outbreak alerts and sends investigative teams into the field to track hundreds of potential threats. More than 180 countries have signed up to the World Health Organization Anti-Tobacco Treaty, covering at least 90% of the world's population. And we are monitoring air pollution in more than 4,000 cities in 103 countries. The World Health Organization is committed to leading the global drive to promote health, keep the world safe, and protect the vulnerable.
You saw many public health challenges, many public health achievements in the last 70 years and many challenges as we go ahead. Without a question, though, one of the most important public health achievements of the past 70 years was the eradication of smallpox. It's the only disease that the world has wiped out. Now, in the mid-60s, outbreaks of smallpox were still occurring regularly in parts of Africa, Asia, and America, and it took nearly 20 years, but in 1980, at a meeting at the World Health Assembly, WHO announced that smallpox was eradicated. Smallpox was a devastating disease. On average, 3 out of 10 people infected died. Those who survived were usually left with scars and sometimes very severe disfigurement. Because of the program's success, there are very few of us who have seen a patient of smallpox, of course. One such person is sitting right here next to me, Mr. John Wickett. He spent 10 years in WHO's smallpox eradication program. Welcome, Mr. Wickett.
Thank you very much.
So for our viewers, this is quite a treat to have somebody, to talk to somebody who was part of this eradication effort. Send us your questions. We'll come to Susanna and she'll ask your question from Mr. Wickett. Let me start with you though. Mr. Wickett, describe to me what it was like during the eradication effort. What was the mood like? If you could hold the mic a little closer to you, please.
Well, the one word that describes it easily is a crusade. You had to have believers dedicated to.
That's interesting. I've had the privilege of talking to a few people who were part of that effort, and those are the words we hear.
Yes, well, it really was. It was something that we were young to do it, and it was just we worked really, really hard. It was amazing. Every day you had to invent something new. There was one small episode I could tell you about as an example of solving problems within the structure of WHO, making it work for you. When I was in Bihar, I was running a fleet of vehicles, and we had a problem in that all the people responsible for these vehicles, they were ones we had bought and we'd given to some young doctors, basically, Indian doctors. And what happened was they would be afraid to get the cars serviced. So what we did, they would come to Patna. What I did, we had a garage, and it was looking after. I'm sorry.
That's all right. Good.
This one. So what happened was we had the responsible officers. I made a list of all the things they could have on the car to be repaired, and with a price. And so they could get their driver to say, this is wrong, but they were protected and they didn't have to worry about someone playing games.
Right.
And we never had any problems anymore with people coming in.
So since it was the first time we were eradicating a disease, there were many challenges that you were facing on the ground. You described to me that it was a very small team in WHO headquarters. Tell me about that.
Well, yes, and we traveled into the field as well. But the chief of the program, the unit, Dr. D.A. Henderson, spent a lot of time communicating with people. He would bring a personality to encourage people to do the work, and so it wasn't it was supervising, helping people to run their own countries.
Right.
So
right.
So it was a catalyst.
Yes.
Is
Countries
the word
took the initiative to also work to put people on the ground, and this was done together by the global public health community. Let me ask you, what was it about smallpox that the experts decided this is a disease we can eradicate?
Well, you got we can start with Jenner when he came up with the vaccination. And then when we had vaccination, there was still a problem that even after 200 years, we were still not eradicating the disease. We had the Russians in 1958 decided that they would give vaccine. You could vaccinate 80% of the population, then we get rid of the disease. Well, this did not work out.
Right.
As thing.
And then ring vaccination was what was adopted.
That came in later on, in closer to 1967,
right,
when they had the intensified program. And in West Africa, they discovered when they were short of vaccine, that they just vaccinated around the outbreak in the isolated cases in the house, and then they got rid of the outbreaks just amazingly quickly. And so this was the ring vaccination. And
right, which was finding a case, finding their contacts, and forming concentric rings in that sense and vaccinating everybody around each
That's right,
case.
anyone that was susceptible.
Right, anyone
Yeah.
that was deemed susceptible. Tell me about this book, Mr. Wickett.
Well, this book,
It's called Smallpox and its Eradication.
yes, now this tells you anything you
If
ever
you could hold your mic closer to you, please. I'll hold the book.
Okay. This book tells you everything that you need to know about smallpox. And it's comprehensive. We had the problem with smallpox was that once it was eradicated, we had to prove it was eradicated. So people would stop vaccination and come up with a savings on the tune of billions of dollars.
So Mr. Wickett, tell me, what was it like when it was announced that the disease was eradicated?
Well, it was in two stages. We had the Global Commission went and verified when they had some countries which were more susceptible to having been infected than others. They would consider that maintaining surveillance would be adequate to detect smallpox case if it had occurred within the past 2 years.
Right.
And then this was all put together.
And that moment when at the World Health Assembly in 1980 it was declared that smallpox is eradicated, what was that like?
That was like tearful. It was really amazing.
Right. I can just imagine.
Yeah.
And I can hear that in voices of vaccinators and voices of people like you who work like warriors to eradicate that disease.
That's the right word.
I want to take a quick question from our audience. Susanna?
Got a question from Annie in Washington, D.C., who wants to know, why is it important to have a multilateral organization like the World Health Organization leading the charge against smallpox?
I'm
So
sorry,
the
I
question is, I know there's a lot of sound here. The question is, why is it important for a multilateral organization like WHO to have led this effort? Why was that important?
That was important because when you're working in the country, you have many different sectors and people that are interested in or not interested in a given program. So what we had to do was get people together to cooperate and
also use examples of where it's been successful, replicate that in other countries.
Well,
and coordinate it across the globe, right?
Yes.
Yes. Well, thank you very much, Mr. Wickett, for sharing your time with us. It was a real pleasure to meet you and to talk to you. Thank you.
Very good.
I want to close today's show with one of WHO's most important roles, that of protecting the world from the spread of disease outbreak. And as you heard Mr. Wickett as well, from the days of when we eradicated smallpox, coordination with all countries to contain the spread of disease has always been a challenge. But WHO does that every day with member states, with countries. We detect outbreaks and we work to contain them. And in this day and age of air travel and trade, diseases travel really fast, sometimes in a matter of hours. We'll talk more about that on Thursday's show, but I want to focus on one disease in 2003. SARS, sudden acute respiratory syndrome, was detected in Asia, and the illness spread to more than 24 countries before it was contained. In the early days of that outbreak, a WHO infectious disease specialist by the name of Dr. Carlo Urbani responded to a request from a hospital in Hanoi to assist with an investigation. They thought that it was a case of severe case of flu. After examining the patient, Dr. Urbani's diagnosis was clear that this was an unknown contagious disease, and he alerted the WHO headquarters. Shortly after that, unfortunately, Dr. Urbani himself developed SARS, and he died in March 2003. His prompt action helped contain the disease and triggered a global response which saved countless lives. Yesterday at the World Health Assembly, Dr. Urbani was honored, and I had the pleasure of sitting down with his son, Luca Urbani, to talk about him. Let's take a listen. Luca, tell me, how old were you when your father died of SARS?
I was 8.
And what do you remember about him? How did he describe his work?
Well, he didn't speak too much with me about his work because I was young. But what I knew is that he was a doctor, and he had to travel a lot for his work, and that's it. I didn't know all about his work, only that he was a doctor, a simple doctor for me.
Now, your family moved with him to many duty stations for his work. How was that childhood for you? Describe that for us, and how did that influence your choices?
I loved my childhood because I knew a lot of different culture, different states, different languages, and this influenced me because now my desire is to work in a humanitarian context, and for this I'm studying languages, and I'm studying languages.
Your brother Tommaso also told us that he's working for a humanitarian agency in Iraq.
ONG, yeah, in Iraq.
Is your choice of work influenced by your father's work?
Yes, not by my father, but by what I've done in my childhood.
Yes.
Where I lived, where I knew different persons.
So you spoke, we learned that you spoke Khmer at a very young age.
Yes.
And how many languages do you speak now?
Now I speak Italian, of course, and Spanish, French, and English, and I'm learning Russian also.
So Luca, what would you like the world to know about your father?
I would like that the world know how my father was doing his work. Like he wasn't doing his work only for money, for fame, or something else, but he was helping others because it was the only thing he wanted, to help people with problems, people that need someone to help them.
And your father was honored today here at the World Health Assembly. The Director General said that your father, Dr. Carlo Urbani, represents the essence of WHO. What does that mean for your family?
We were very grateful to the WHO to remember him, especially in front of all the state members that maybe they didn't know the story of my father, but after today they know what my father did, and this I hope will motivate all the persons that do this work to do it better, and for the others, for the people who need it.
Thank you very much, Luca, especially for speaking in English with us. You speak so many languages, and I really thank you for your time today.
Thank you.
That was Luca Urbani talking about his father, Dr. Carlo Urbani. There are many others who lost their lives in the line of service to global public health. And these people range from health workers, frontline health workers, and to people who work in global health at our regional and headquarters levels. You also saw an image of Dr. Mahmoud Fikri, who was the regional director of WHO's Eastern Mediterranean region. We lost him last year as well. So as we close the show today, we want to pay tribute to all these public health heroes and their families. The world is truly a better place because of them. And with that, we want to end today's show. We'll see you again tomorrow. Bye-bye.